We are very lucky to have Dr. Consagra back in her home state of North Carolina. She's an incredible leader, so much passion, and she has really ignited the work to fight the opioid crisis here in North Carolina.
To be surrounded by such a great team, to have such great leadership that supports you every step of the way, I couldn't have asked for anything more. And so I feel like that is really a reflection on the great support and people we have around us.
I think Dr. Consagra's work's important because she came in to the body of work at a really challenging time. The death rate from the opioid epidemic was really spiking up high with the introduction of fentanyl.
North Carolina was incredibly hard hit by the opioid epidemic.
That was an incredibly important moment for us as a state to pull together not just the public health space, but mental health and Medicaid and our education partners and law enforcement. She was the leader who put together our first statewide opioid action plan back in 2017.
She was able to get everybody into the same room and work together and find what their contribution and strengths could do and maximize everybody's effort.
Some of the key messages of the Opioid Action Plan are to encourage our communities and as a state to work on activities that promote judicious prescribing of opioids and also increase access to treatment and recovery supports. And that's happening in such a wide variety of ways.
This is an epidemic that involves a lot of different disciplines, so it's not just public health.
From executing the strategies in the plan, we are starting to see some really good results. So we're seeing our first ever decline in opioid overdose deaths in the past 5 years, our first decline in emergency department visits for opioid overdoses in the past decade. We're seeing increases in the number of folks who are accessing treatment, and we're seeing declines in opioid prescribing since the launch of the plan.
That's hundreds and hundreds of lives saved. She has been an integral part of that.
She cares about the people that she works with, and she cares about the people impacted by her work.
We're so thankful she's getting the recognition she deserves today for all the work she's done thus far.